Hey, good morning, everyone. I'd like to call what is the day? June 27th Finance Committee meeting to order. Can I have a roll call, please?
Member Cahill. Member Chaplin.
Here.
Member Childress.
Yes.
Member Covert.
Here.
Member Desart. Member Eckhoff. Member Evans.
Here.
Member Galassi. Member Garcia.
Here.
Member Guston. Member Krajewski. Member LaPlante. Member Ozag. Member Rutledge. Member Schwarzy. Member Tonatori. Member Yu.
Here.
And Member Zay.
Okay, we have a quorum. I am advised that we do have public comment this morning. So I'd like to welcome to the podium Julie Yurko from Northern Illinois Food Bank. Hi, good morning.
I'd actually like to hold till 10 for the full board meeting, if that's possible.
Oh, I'm sorry, what was that?
I'd like to hold my comments till 10 o'clock.
Oh, that's fine.
Oh, thank you very much.
All right, thank you. Okay. All righty. Do we have any other online? Okay. So with that, we move on to Chairwoman Marks. So last meeting, Member Tornatori had questions regarding the Northern Illinois Food Bank. Staff is actively engaged in gathering additional information, and we're committed to thoroughly investigating the matter to ensure that any potential issues are addressed promptly and effectively. Following scheduled meetings this week, we'll assess the need for further discussion and consider including the topic on a future agenda. So that may come up, it may not, depending what happens over the week. With regards to the Affordable Housing Committee meetings, we're going to try to shoot for 2 meetings in August since we're behind from June and July. So just keep that in mind. And just a reminder for department heads and elected officials, the deadline for budget submittals is this Friday, so we'll need those in from all department heads and elected officials. We are planning to have a pre-budget workshop meeting on July 25th. So if you can mark that on your schedules as well. And then as of today, the clerk has done everything needed to assure that all invoices, budget transfers, and change orders have been submitted, which allow all invoices to be paid and bring everything current. The treasurer has agreed to do a special check run tomorrow to expedite payment on all the invoices. So we have some good news coming out of the clerk's office. And with that, can I have a motion to approve the minutes of the regular Finance Committee meeting from June 13th? I have a motion by Member Rutledge, second by Member Yu. Any discussion changes? Okay, all those in favor? Opposed, the motion carries. We move on to item 6, budget transfers. Can I have a motion on budget transfer 23-2184, transfer of funds from account 5,042.50 53807 software maintenance agreements to account number 5,04250 54100 IT equipment in the amount of $17,350 to cover costs associated with the Illinois voter registration system. So I had a motion by Member Ozag and a second by Member Yu. Any discussion? I'm sorry. Motion by Member Rutledge, second by Member Yu. Any discussion on this? Oh, I'm sorry. Okay. Just for clarification, allergies are coming up and my ear is plugged again, so I'm having trouble hearing. So please bear with me. Thank you. Well, just one ear. See, we need our microphones. Okay, so motion by Member Ozak, second by Member Rutledge. Any discussion? All those in favor? Opposed? The motion carries. Can I have a motion on 23-2187 transfer of funds from account number 11001215 53010 engineering and architectural services to account number 11001215 51070 tuition reimbursement in the amount of $2,260? I had a motion by Member Childress, second by Member Garcia. Any discussion? All those in favor? Opposed? The motion carries. Can I have a motion on 23-2188 transfer of funds from account number 6,01195 5382828 contingencies to account number 6,01225 54107 software in the amount of $86,870 for Ceridian Management Payroll System one-time costs. So I had a motion by member Yu, second by member Childress. Any discussion? All those in favor? Opposed, the motion carries. Can I have a motion on 23-2188 transfer of funds from account number 6,1195-53828 contingencies to account number 6,1225-54107 software in the amount of $86,877 for Ceridian Management Payroll? We just did that one. Okay, can I have a motion on 23-2186 budget transfers, 627-23 various companies and accounting units? Moved by member Rutledge, moved by member Ozak, second by member Rutledge, member Garcia. Okay, do you have a question? No, okay. Yes, any discussion? Yes, all those in favor? Opposed, the motion carries. Thank you. We move on to procurement requisitions. Member Krajewski under finance.
Thank you, Madam Chair. I move on 23-2153 decrease purchase order. Issue the Renbeck Collection Services, Inc. Amount of $379,916.84.
Motion by member Krajewski, second by member Garcia. Any discussion? Okay, all those in favor? Opposed, the motion carries. Thank you, member Krajewski. We move on to economic development. Member LaPlante.
Thank you, Madam Chair. I move to approve EDCO 002-23, amendment to purchase order 6160-0001 serve issued to Dell Marketing LP for an increase to the existing service level Microsoft Office 365 government licenses for Workforce Development Division for an increase of $13,905.50. for a new contract total of $51,026.29.
I have a motion by member LaPlante, second by member Yu. Any discussion? All those in favor?
Aye.
Aye.
Opposed, the motion carries. Thank you, member LaPlante. We move on to human services. Member Schwarzy.
Thank you, Madam Chair. With regards to report, I just want to make some comments on follow up with your comment regarding the Northern Illinois Food Bank and some concerns about the quality of the produce that's being delivered to our township. So we've been Human Services, myself, Mary Keating, have been certainly taking this very seriously, and we have followed up. I'll just tell you the course of action we've taken to this point. So I after last meeting and the report from member Tornatore about Addison Township, I had Mary investigate. So she reached out. At this point, she's reached out to a dozen other townships. The good news is we weren't getting any other complaints at this point. So we'll continue to follow up with many more of the other townships. Both Mary Keating and myself have spoke numerous times with the Northern Illinois Food Bank Director, Julie Yurko, let her know what we're hearing, what our concerns are. Today, actually at today's delivery in Addison Township, they do have a delivery coming today. We will have both county staff and executive staff from the Northern Illinois Food Bank will be there to attend the delivery, just to, see if, so they can talk in person and evaluate together. So we do have a meeting with the smaller pantries later this week, but that's with the nonprofit pantries. We will have a follow-up meeting with just the township pantries too. And that way we'll make sure we're covering everybody. So that's where we're at today. And thank you for giving me the opportunity to share that with you in this board. So with that being said, I motion to discharge HS committee from item 7C1 23-2210.
The motion by member Schwarzy, second by member Garcia to discharge committee. All in favor? Opposed? Motion carries. Member Schwarzy.
Thank you. I move to approve item 23-2210, a transfer of funds from account number 5,021-15-52-320 to account number 5,021-15-52,000 and 5,021-15-54-110 in the amount of $106,000 to reallocate grant funds. It was determined there was a greater need for machinery and equipment, both small and large, than for the items that would have been classified as medical supplies.
Okay, I have a motion by member Schwartzy, second by member Guston. Any discussion? All in favor? Opposed? The motion carries. Member Schwartzy.
Thank you. I move to approve item HSP 5923, a recommendation for the approval of a county contract to Benovating, doing business as Neighborly Software, to support the grant application and management process within the Community Development Division. This contract covers the period of July 1st, 2023 through June 30th, 2024. The second option of the 3 one-year renewals for a contract total not to exceed $45,000.
Okay, I have a motion by member Schwartzy, second by member Guston. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Schwartzy.
Thank you. I move on item HSP 6023, a recommendation for the approval of a contract purchase order to Global Industries for touchless automatic paper towel roll dispensers for the DuPage Care Center for the period June 28, 23 through November 30th, 23 for a contract total not to exceed $74,200 per contract pursuant to the Omnia Partners R211402.
I had a motion by member Schwartzy, second by member Guston. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Schwartzy.
Thank you. I move on item HSP 6123, a recommendation for the approval of a contract purchase order to McKesson Medical Surgical Government Solutions LLC to furnish and deliver incontinent products for the DuPage Care Center for the period June 30th, 23 through June 29th, 25 for a contract total not to exceed $240,000.
Motion by member Schwartzy, second by member Guston. Any discussion? All in favor? Opposed? The motion carries. Thank you, member Schwartzy. We move on to judicial public safety, member Evans.
Thank you, Madam Chair. I would like to move on JPS CO 000523, recommendation for the approval of an amendment resolution to JPSP 027522 for a change order amending purchase order 6096001 serve issued to Public Safety Direct to increase the contract amount of $466,816.70, resulting in an amended contract total not to exceed $726,816.70.
I have a motion by member Evans, second by member Cahill. Any discussion? All those in favor?
Aye.
Oh, member Desart, I'm sorry.
Thank you. I saw Under Sheriff Moore here. We discussed this in JPS, but because it is 179.54% increase, I'm just wondering if Under Sheriff Moore could come up and discuss what we discussed in the JPS committee. Thank you, Under Sheriff.
Morning, Under Sheriff Moore.
Why is the sudden being increased by almost 180%?
Because I have 36 cars I got all at one time. I got my 21s and my 22s, excuse me, my 22s and I'm confused now. My 22s and my 23s all at one time. COVID kept the cars at bay forward. There were some issues with a couple of microchips and some other things that we didn't get the cars on time. Now that I have the cars, I stripped down some of my old cars to put the stuff into the newer cars, but Ford changes the sizes of the cars just a little bit every once in a while with the cages and whatnot, so they don't fit. So I have 35 cars right now. I cannot put on the street unless I have these funds to get them fully outfitted.
So this is for outfitting the cars to be police cars, correct?
Correct.
Okay, and this will be coming out of, I believe Nick said, the auto contingency fund.
Correct.
All right, thank you.
Thank you. Thank you, member Desart. Okay, so all those in favor? Opposed? The motion carries. Thank you, member Evans. We move on to Public Works, member Garcia.
Thank you, Chair. I move for approval of FMCO 007223, amendment to resolution FMP 038521, issued to Builders Chicago Corporation to provide preventative maintenance, service, and repairs for overhead doors, roll-up shutters, gate operators, dock levelers, and revolving doors as needed for county facilities. For facilities management for a change order to increase the contract in the amount of $20,000, resulting in a new contract amount not to exceed $212,520, an increase of 10.39%.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed? Motion carries. Member Garcia.
I move for approval of FMP 007123, recommendation for the approval of a contract to the Standard Companies to furnish and deliver plastic trash and recycling can liners as needed for county facilities for facilities management for a period of July 14, 2023 through July 13, 2024, for a contract total not to exceed $40,000 per renewal option under bid award 21036 FM, first option to renew.
Motion by member Garcia, second by member Galassi. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Garcia.
I move for approval of FMP 007223, recommendation for the approval of a contract issued to Ron Terrapelli Ford for the purchase of 2024 Ford F-650 diesel for facilities management, grounds maintenance for a total cost not to exceed $113,297.66, not suitable for competitive bids per 55 ILCS.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Garcia.
I move for approval of PWP 003623, recommendation for the approval of a contract purchase order to CDW Government LLC for computer hardware, peripherals, software, and licensing on an as-needed basis for public works facilities for the period of June 27, 2023 to February 28, 2025, for a total contract amount not to exceed $35,000. Contract pursuant to the Intergovernment Cooperation Act.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Garcia.
I move for approval of PWP 003723, recommendation for the approval of an agreement between the County of DuPage, Illinois and HBK Engineering LLC for on-call professional engineering services for water distribution and service sewer collection systems for various regions around DuPage County for the period of June 27th, 2023 to November 30th, 2026, for a total amount not to exceed $95,000.
Motion by member Garcia, second by member Yu. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Garcia.
And I move for approval of PWP 003823. Approval is requested for the County of DuPage to renew its membership with the Lower Des Plaines Watershed Group for Public Works for an amount not to exceed $93,000 for 2023 to 2026 membership dues.
Motion by member Garcia, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Thank you, member Garcia. We move on to technology. Member Yu.
Thank you, Madam Chair. I move on TEP 005523, recommendation for the approval of a contract purchase order to AT&T Mobility for the annual licensing and maintenance of AirWatch mobile device management for information technology. This contract covers a period of July 1, 2023 through June 30, 2024 for a contract total amount of $34,860.
I have a motion by member Yu, second by member Childress. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Yu.
Thank you. I move on TEP 005623, recommendation for the approval of contract purchase order to Shy International Corp for the procurement of VMware licensing to update the county's current virtual infrastructure for information technology. The contract covers the period of July 17, 2023 through July 16, 2026 for a contract total amount of $500,947.91.
I have a motion by member Yu, second by member Guston. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Yu, thank you very much. We move on to transportation and member Ozog.
Thank you, Madam Chair. I move for approval of 23-2071 DTP 0155B22, amendment to resolution DTP 0155A22, issued to Patrick Engineering for professional phase 1 preliminary engineering and phase 2 design engineering services for improvements to the bridge carrying County Highway 21 Geneva Road over the west branch of the DuPage River to increase the funding in the amount of $25,371.12, resulting in an amended contract total of $719,749.70, an increase of 3.65% and a cumulative increase of 35.31%.
Motion by member Ozog, second by member Rutledge. Any discussion? All in favor?
Aye.
Opposed? The motion carries. Member Ozog.
Thank you. I move for approval of DTP 007823, recommendation for the approval of a contract to LRS Holdings LLC, doing business as Lakeshore Recycling Systems LLC for solid waste disposal services as needed for the Division of Transportation for the period June 28, 2023 through March 31st, 2024 for a contract total not to exceed $66,000 per lowest responsible bid.
Motion by member Ozog, second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Ozog.
Thank you. I move for approval of DTP 007923, recommendation for the approval of a contract to Traffic Control Corporation for annual maintenance and support services for the Division of Transportation Centrax ATEMS software system for the period July first, 2023 through June 30th, 2024, for a contract total not to exceed $35,345 per 55 ILCS, not suitable for competitive bids, proprietary software maintenance and support.
Motion by member Ozak, second by member Rutledge. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. And thank you, member Ozak. We move on to finance resolutions, and I'll call on member Krajewski.
Thank you, Madam Chair. I move on FIR 0152-23, acceptance appropriation of the Illinois Department of Commerce and Economic Opportunity Rapid Response Grant, $500,000.
Motion by member Krajewski, second by member Desart. Any discussion? All those in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0154-23, acceptance appropriation of additional funding for the DuPage Animal Friends Unrestricted Grant from $50,000 to $75,000, increase of $25,000.
Motion by member Krajewski, second by member Desart. Any discussion? All in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. On this one, I motion to discharge committee.
Motion by member Krajewski, second by member Garcia to discharge committee. All in favor? Opposed? Motion carries. Member Krajewski.
Thank you, Madam Chair. And I move on FIR 0159-23, acceptance appropriation of the Illinois Department of Healthcare and Family Services grant in the amount of $102,000.
Motion by member Krajewski, second by member Desart. Any discussion? All those in favor? Opposed? Motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0153-23, approval of issuance of payments by the DuPage County to various training providers to the Illinois Department of Commerce and Economic Opportunity in the amount of $328,000.
A motion by member Krajewski, second by member Desart. Any discussion? All those in favor? Opposed? The motion carries. Member Krajewski.
Move on FIR 0155-23, recommendation for an amendment to the Aging Case Coordination Unit Fund in the amount of no dollar amount.
Motion by member Krajewski, second by member Desart. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0156-23, approval of an agreement between the County of DuPage and the DuPage County Health Department for the use of ARPA funds in the amount of $21,771,294 ARPA.
I have a motion by member Krajewski, second by member Garcia. I have member Guston and then member Zay. Member Guston, go ahead.
Thank you, Madam Chair. Yeah, in reviewing the resolution for this, the ARPA money obviously is going to be used for mental health and addiction. And I noticed in paragraph 4 that the obligations of the county did not include substance use. So to amend it and correct it, I talked with legal staff. Legal staff came up with the language and suggested, and I support adding mental health is there, but adding substance use services also for the county, which falls under the American Rescue Act funding initiative. So I would make a motion that we add the language in paragraph 4 for the county wishes to obligate $21,771,294 to the Department of Health, to the DuPage County Health Department for various expenses related to 1, public health, 2, mental health, adding and substance use services, 3, payroll administrative needs, and 4, capital projects.
Okay, so I have a motion to amend by member Guston and a second by member Desart. Any discussion on the amendment? Member Tornatori, and then we'll get back to you, member Zay.
Thank you. Certainly the Crisis Recovery Center will be taking into account those who are undergoing crisis issues dealing with substance use. If those of you who have seen the presentations know that there's a pod for substance use. And so I have no objection to adding this. The way the resolution was drafted was very general. It's going to deal with people in crisis in whatever way they're in crisis. So if it pleases member Guston to add substance use, I have no objection. Just want everybody to know it was not left out for any particular reason.
Thank you, member. Thank you, member Torrentori, for that clarification. Member Desart?
I agree with this as well, and I seconded the motion. I just wonder, and member Guston said that she had attorneys look at this. I'm just wondering, and I don't want to get bogged down in semantics, but shouldn't it say and substance use disorder services? Just
I have legal staff here, so maybe they can respond to the verbiage or the language that was added into it. We talked about it for about 10 minutes as to
Okay.
what the right wordage would be, because the legal eagles need to make sure that we have it all not too tailored, but yet accurate enough to be effective.
And good morning, Adam.
Thanks,
Chair-
Adam. I'm just wondering if the word disorder should be added in there. Thank
Thank you. To clarify, I'm not legal staff, health department staff. But substance use services is broad in general enough for us to incorporate treatment as well as education, general support. So we were comfortable with substance use services if that is acceptable for the
Okay,
board.
excellent. Thank you.
Okay, thank you. Any further discussion on the amendment? Okay, all those in favor? Opposed? The motion carries. Now we're back to the original motion. And Member Zay, you had a question.
I did. Thank you, Madam Chair. You know, I noticed after we had the presentation the other day, there's an additional $5.8 million for more capital. I mean, it's 4.8 million for Health Department Central Office remodel and another $1 million for Health Department Kurzweil remodel. Can you explain that? I mean, we're taking money. I mean, it's the American Rescue Plan. I don't know who we're rescuing doing more capital. I think we could use this better off. And like I said, you had a big presentation. We heard nothing about almost $6 million of additional remodel over there at the health department.
You're correct. We did not explicitly discuss those projects with this board. Those projects are driven by mental health service expansion. It will enable both an expansion of our outpatient, our youth and family, our substance use services that are already existing. So you're correct. We've been presenting and engaging with this board primarily on the Crisis Recovery Center and expanding the need for mental health, crisis mental health services. The health department over the last couple of years has been undergoing an expansion in the need of services, again, in our existing service lines of outpatient, substance use groups, or youth and family services. So those capital projects are really driven by that need.
Okay. And is there any update? I mean, again, maybe I'm just different. I come from the private sector. We still hadn't got an update on how you're going to pay for operations for this new community center. I mean, we had our District 6 meeting the other day. We had municipalities asking, how are you going to pay for it? What's the ask going to be? Again, it seems like we're almost hurrying this too much before we have the answers on how we're going to pay for it, because if paying for it is a huge tax increase, property tax increase by the health department, I mean, we have to find a different way to do it.
I understand. Yeah, it's a great question. The operational budget is our top priority right now. The sustainability plan is in development, is the priority we're working on. Our number one way that I think Karen talked about it before is, of course, we're going to first maximize Medicaid billing and reimbursement, to which the health department has a lot of experience with. We're successful at 90+% of our claims all the time. So we're looking at Medicaid first, cover probably roughly 25% of our costs right up there. We're then going to pursue diversification of our payer mix to bring in private insurance billing for crisis mental health services, which is not something that health department has historically done. So that will be a new payer mix for us that will also help cover some of the costs. Beyond that, we are looking at a blended strategy. We're looking for strategic partnerships, leverage partnerships for funding, and we're optimistic that we're going to be able to do that. But it's a great question. We believe there's a lot of options, but there is a lot of work to do. And if it was more comfortable for the board that I come back with periodic updates on that sustainability plan and that financing plan, I'd be happy to do so.
I think that would be appreciated. I mean, the build it and they will come. I mean, maybe works in the movie, but I want to, make sure that, there is a plan for moving forward. And like I said, municipalities are asking too. So, they haven't been asked yet. So, it looks like there's a lot of work to do. I just want to make sure we're not rushing the construction and then we get it done and we're kind of sitting here going, well, maybe we should have talked to the hospitals. We should have talked to the townships. We should have talked to municipalities. It's obviously a huge undertaking, but if you came back with updates that would be, I think that
Happy-
would
Happy to
satisfy.
do so. Yeah, I share the concern. I think it's worth noting, the health department we take our responsibility towards fiscal stewardship very seriously. We have not, I think it's been approximately, well, in the 17 years I've been with the health department, and I think a little longer, the health department has not sought a tax increase to our levy. And our intention is to continue that path of fiscal stewardship. We tend to take our levy that we have and prioritize it and stretch it and find grants and other opportunities. And we're looking to do the same thing with this. But I'll be happy to stay. It's a lot of money. Happy to stay engaged with you and provide you those updates.
Great, thank you.
Thank you, Member Zay, for the question. And thank you, Adam. I think it would be great, if you can come in every once in a while and give us that update on, how things are moving along.
Happy to do it.
And thank you. Thanks for attending today's meeting. I have Member Torrentori, then Member Krajewski.
Yes. $4.8 million is for crisis services in the existing facility. That was as explained by Adam. The extra $1 million that Member Zay brings up is to essentially remove the kitchen from the Kurzweil Center so that it can be used for crisis services, because there's not really a lot of cooking that's going on over there. So I think everything has been laid out, although maybe not as specific as apparently some people in District 6 are concerned about. But just so everybody understands, this isn't bill that we will come, okay? This is, we have to build it, period. And if we don't build it, nobody's going to come. So I understand the concern about operations, and time again, I think we've heard that about 50% of the operational expenses are pretty much going to get locked in with Medicaid reimbursements. And there may be more with that as the state adjusts the reimbursement. There's got to be buy-in from the hospitals and from everybody, because this is going to be something which is going to take away from everybody, including the municipalities. And all those municipalities, police and fire departments who are concerned about extra costs to come here, I will once again reiterate, it's cheaper to bring people here than it is to EDs and to keep them in their police departments and fire stations. And if it becomes too expensive for those municipalities, they don't have to do it. They can continue to do what they're doing. There's nothing mandated to anyone that they have to bring somebody in crisis to the Crisis Recovery Center. So this is a benefit. And quite frankly, I don't share the cynicism apparently that some people have towards this. Obviously, I'm prejudiced because I'm in the middle of this, but we've got to build it. And we're not doing this on, as they say in craps, on the come, okay? We're doing this because we need to do it. So I want everybody to know there's no intention for a tax increase. Really, that topic, and even bringing the word tax increase into this, I think is just unnecessary, because it's never been even broached at the board level at the health department. So rest assured, we're going to be good stewards at the health department as we have in the past. Thank you, Madam Chair.
Thank you, Member Torrentori, and I appreciate your comments. And I don't know if everybody had a chance to read the public comments, but in our public comments yesterday, there were quite a few fire departments that did express their support for the crisis center. And this really didn't come out of nowhere. When Chair Conroy was a state representative years ago, she secured the $5 million grant, and we kind of sat on it. So I'm very proud that our chairwoman has made this a priority and that we're moving forward with it. And because we all have heard about all of the mental health issues, especially with our youth. So I appreciate everybody's questions. And again, thank you, Member Torrentori, for your comments. So I have Member Krajewski and Member Rutledge. So Member Krajewski and then Member Zay. Member Krajewski.
Thank you. And I agree with Member Zay a little bit with regards to just the ongoing operation costs. I'd feel more comfortable if I understood how much we're talking about and where the funding is going to come from, because I've heard some no tax increases, but not sure we have a plan. Not last Thursday, but the prior District 3 meeting, that same issue that District 6 had was raised by the District 3 mayors also with regards to this. So I believe that one, I think we just need to communicate out to the various districts and the mayors regarding that. But I just heard Board Member Torrey said 50% of this ongoing is going to be funded by Medicare. I think I heard you say 25% or Medicaid. I think you just said 25% was going to be funded. I understand the cost 21 million, but the ongoing operations, do you have an idea? One, is it 25 or is it 50? Because I just heard two different numbers.
Sure. So our estimate for annual ongoing cost to operate the facility are about 5.5 to 6 million. That's our current estimate. Medicaid specifically, we're looking at probably 25 to 30%. I think Member Tornatori referencing 50% is when we bring in some of the commercial payers as well. So in terms, we are optimistic that 50% of costs can be covered by direct service billing, whether it's Medicaid,
or
other
regular
payers.
insurance is the 50, but Medicaid is only about 25.
Yeah, I mean, we've seen estimates go from close to 40% on Medicaid. That might be even a little too sunny and optimistic for me. I think we're probably more in the space of 25 to 30% from Medicaid directly.
Okay, so and you think the ongoing cost is going to be 5.5 million?
That's correct.
Okay.
That's our estimate at this point.
Right, and half is going to be Medicaid or insurance. The other half is going to be what you're saying, grants and public-private partnerships.
So, yeah, so there's a lot of options. One other thing that we're looking at, what could bring that, 50% even higher is we're working with, for instance, a consultant, Health Management Associates, and then working with the state of Illinois on options like enhanced payment rates or per member per month value-based outcome payments. So we're actually looking to kind of grow up with the state some of the opportunities for the reimbursement to even eclipse that 50% number. But there is still going to be a gap. And I acknowledge there is work to do. When you guys are referencing the municipalities, I think that reality is there. We need to, if we're asking them for money, we need to sharpen the ask for them and continue to dialogue with them about what that means for them. So far, we've given them a presentation similar to what we've given this board and our Board of Health about what we're trying to do. So yeah, there's work to do.
Presentation like at DuPage mayor's managers.
That's correct. Yeah, we did. Suzette and her team helped us set up actually 3 different sessions, 3 different village halls in the county. I think we went to Westmont, Winfield, and Warrenville. Yeah. Elmhurst, Warrenville, and Westmont, and they hosted. And so the mayors and managers could come to any one of those 3 sessions and we talked it through. But they expressed the concerns. I'm sure they're sharing with you directly with us as well. They were not shy about that. And I think it's a continued dialogue and partnership that we're hoping to.
So it's about $3 million we're going to try to raise in some fashion, increase Medicaid funding, increase private insurance pay, and find grants. But 3 million is about the number.
I think that's fair. Yeah, with a $3 million gap, that's fair. We're interested in all options. I know Member Cronin Cahill mentioned last time when we met, looking to the private sector. I think there's some room there for opportunity as well. So all those options are on the table. Again, I recognize we're asking for a good amount of money here. So I want to do this in partnership with you guys. If there are ideas like that or there are connections to be made, we're happy to sit down with those folks and continue to fill that gap. We've got a big gap, but I've got a little bit of time too. So
thank you.
These are great questions.
Yes, very good questions from everyone. I have Member Rutledge, then Member Zay, then Member Garcia. So Member Rutledge.
Thank you, Chair Chaplin, and thank you, Adam, for your efforts on this. I just want to say, as a District 6 representative, I fully support this effort. I think that we are going to have to get creative with the funding ongoing for this, but clearly it's a need in our county. I heard a report this morning, Member Chaplin mentioned our youth, that test scores from pre-pandemic are down fully at 10% in reading and math scores. So this is a need that we have to fulfill. And I think that we will creatively find ways to fund it ongoing. So that's my 2 cents. And I would hope that Member Schwarzy, as another District 6 representative, would agree with that as well. Thank you.
Thank you, Member Rutledge. Member Zay.
Well, I guess that leaves the only other District 6 member left. Asking questions is good government.
Yes.
I hate to say it, and maybe my friend is too close because he's at the health department. But when we're talking about a $25 million building with $5.5 to $6 million operations, and we don't have everything down, there is a need here. And I didn't bring up property tax. This was in the presentation the other day. First line says operations budget / tax dollars, which pretty sure it is the property tax levy. So again, I'm not saying I'm against it. I'm just saying there's questions out there. I mean, again, I come from the private sector. My first questions when we started to build this would have been and gone to maybe the people who provide the service first would be the hospitals, right? And go there and make sure they have buy-in, make sure everything else. That's what I'm just saying is let's make sure we're doing everything that we need to do, that we're not rushing this just to build it. I may know we got $5.5 million from the state, but we're putting up the good majority of it. We're putting up over 80% of it. So again, it's not that I'm not against it. I'm just not going to go blindly and just say, oh, it's okay, let's just build it and we'll figure it out later. That's kind of goes with, you know, that's how you do it in the private sector. I just don't go out and buy a 200-ton press and figure out now, you know, can I afford it? Who can run it? You know, do I have the jobs to run it? I know we have the need, but let's just make sure we're doing this right. And again, I appreciate you saying you're going to come back to us and that's great. And again, yes, there is a need out there and I'm not against the project. I just want to make sure we're, you know, 3 years down the line, we're not sitting there scratching our heads going, what happened? So thank you.
Understood.
Thank you, Member Zay. So I have Member Garcia, Member Ozog, and then Member Krajewski again. So Member Garcia.
Yeah, thank you. Thank you so much. And I do appreciate the questions that Member Zay is bringing up, but I passionately feel that this is something that has been needed for so long. I've been one of the vocal people who have been pushing for this to happen. There is as I think I mentioned last time, there is a new pandemic out right now, and it's called mental health, especially with our youth. And so this building needs to be built. They're actually waiting around the corner for it to be built. We have a line. There are the numbers of youth that are dying by suicide has increased exponentially over the last couple of years. I am also involved with a lot of the 708 mental health boards, and they're looking forward to this building and will be helping to fund what we've been talking about. So there are people out there that are ready to help fund the gap and are ready to come and help. So there is some people that are in line to really help with this. And yes, I do agree that we need to have everything done, but this is a need that I know that our country and our state, and I know even when we met with our District 2 mayors and managers, they are excited to see this coming. And perhaps that's because you did one in Elmhurst, but I mean, they're excited to see this happening because they don't want to have their people taken to the correctional center anymore. And I'm hoping that that is something that stops and that we are taking people to where they can get the help that they need. So I am so grateful to this, and I'll be a passionate yes on this. Thank you.
Thank you, Member Garcia. Member Ozog.
I'm not sure, but does the Affordable Care Act require mental health coverage? I thought it did.
Yeah,
so-
it is, yes. Since the ACA, it's one of the required services to be covered in any plan. There are still plans that are sold out there that are not totally compliant, but it's eliminated most of that. The ACA compliant, it requires mental health to be part of the package.
So that's some leverage over private insurers, et cetera. So-
Yeah.
Okay, thank you.
Yep.
Thank you, Member Ozog. Member Krajewski.
The last thing is more regarding questions were raised at the prior, my District 3 with the mayors. One, you know, they still probably have the option of taking like they do currently to the area hospitals in my district, which would be Ventus, Hinsdale, or with Sam. And they may still do that, I think, correct? They're not going to be required to come out here.
Oh, correct. Yeah, we look at this as another tool available to them.
Correct. And to the extent they all do coming out here and then there's extra requirements for hospitalization, does that pretty much mean CDH is going to be the one that's going to take in these people since they'll all be out here if they have to then move to the hospital?
I think that's a fair assumption. I think there's some work to do there, but we are, Lori, our behavioral health leader, is working with the hospitals and with CDH that if there is an escalation, that is the most likely destination. Yeah.
And had we reached out and worked with CDH to let them know that this may happen? Because I know we did something with ARPA. It was a need for, we did pads to help for people, and we gave them money to buy the Red Roof Inn in Downers Grove, and then all these people descended into that one facility, which then the byproduct was they all that had children went to the little grade school that was right there. The school district became overwhelmed with transportation and stuff with people there. I could see the same thing if CDH make sure that they're prepared for it. And then last, you did meet with the district or the DuPage mayors and managers, talk about the plan. And you mentioned, I think a little bit earlier, we may be reaching out to them for money also. Was that raised at that meeting that we presented DuPage mayors, that you may be asking the mayors to participate in the funding of this?
So last question first. Yeah, it was, so it's on the slide deck that they're a potential source of sustainable funding.
Well, I know they're on the slide
So-
deck. I don't know if we've told them.
So they received that presentation, and that was essentially a lot of the discussion of each of those 3 sessions was their wanting to know a lot more before they were ready to commit to funding. The CDH question, I would just address in a couple points to say, the good news is we've had a very long standing relationship with Northwestern CDH of shared patients. We've worked on grants with them together for mental health for a number of years, but yes, they're very engaged in the discussions. At our last external stakeholder meeting last week, they had 3 representatives there, their director of behavioral health, their chief medical officer. And so they are very engaged in understanding what we're going to do here. We plan that the care model will result in not that many escalations from us to them. In fact, we kind of hope that it's the other way. Either people come only to us and then are released to the community, or if they need to step down from an inpatient stay at the hospital, they're coming to us. So that's what we're talking to them about. And they're at the table.
And then the last question, I'm not sure you're one to answer, maybe somebody else here, but with regards to the jurisdiction now, the facility is going to be built is in the village of Wheaton, so their police would be ones that would come to if there's an issue. Is it correct?
You'd be correct that I am not able to answer that question.
Currently, and
you are correct. Currently, the city of Wheaton has jurisdiction.
And are they looking to de-annex that to give it to us?
We are working directly with the city of Wheaton for de-annexation, possible de-annexation. There are no, I mean, we're still in negotiations for that.
Which then they want to give it to us, so then it becomes our sheriff's responsibility.
Correct.
So again, I'm just trying to look at, because I remember when pads came in, and we did a nice thing there. We created a lot of extra costs for the school districts regarding transportation. Now I'm looking at CDH, maybe the one that's, I just want to make sure that they're aware. Now we may be taking over the responsibility at the sheriff's department, so which may require additional, let the sheriff come in asking for additional money. I just want to make sure we see all the things that are out there when we do something and make sure we know what the costs are going to be. So I got the 6 million, but and we're in negotiations with that.
For de-annexation, we are meeting with them regularly. Our staff's meeting with their staff. We have an outside attorney that is coordinating with our state's attorney. It's probably 4 months.
What would be the reason Wheaton doesn't want it anymore?
It's just a matter, there's a lot of aspects to de-annexation. You have to deal outside of police coverage. You have water, you have different aspects. All of that is being discussed and talked about.
I know, but why does Wheaton want to get rid of that property?
Well, maybe that's a discussion to put on the agenda for another time, because it's kind of out of the scope of what we're talking about with this item. So, but we can definitely put that on the agenda about the de-annexation of Wheaton and how.
How's it out of the scope of the item when it's going to be additional costs if the sheriff's now going to have to jurisdiction of that property? I mean,
there are benefits to both parties to go to de-annex, and benefits to both parties to stay annexed.
Okay.
And so everybody's trying to sort through it. It's a long process, obviously, and we're working with the Public Works Committee on that issue, and we will continue to do that. And we can definitely do updates. I can do individually or to the committee, as I really don't have any new information. We are in discussions.
So then on the flip side, then our zoning would, or our.
You are correct. Our zoning.
So our zoning would.
Building and zoning would then govern what happens here on campus.
For the new building, which may be less restrictive than the.
That is correct.
Than the zoning for the village of Wheaton.
Yes.
Okay. City of Wheaton, city of Wheaton.
Okay.
So.
Okay, thank you.
Thank you. Zoning questions are okay too, right? Because it's the building where.
Well, yeah, we were just conferring about this topic being in public right now. So, but anyways, thank you. Are you
transparent, aren't we?
Yes.
Thank you.
But the state's attorney did bring up some concerns to me. So that's, so anyways, Member Krajewski, do you have any other questions? Okay. So Adam, if I could just follow up on Member Krajewski's questions. Would the Crisis Intervention Center have any security on the premises? Would you be hiring, because hospitals have security on premises. Would you have any, do you think you'd have security there?
Yeah, we would need to have security. There's some security costs in that existing operational budget
Yes.
now. They'll need to be
Yes.
evaluated.
Yes, because I know at hospitals, a lot of time when there's an issue, security is called up and many times security handles it and then they hand it off to the police. So I don't know how, but security will be there. So that's.
You're correct. Yeah, I mean, we're saying we want folks who are in a mental health crisis to come to us rather than go to an emergency room or to a jail. And those emergency room jail being the place they currently are, there's heavy security in those facilities. So we will look to have sufficient security on premise 24/7.
And then, excuse me, it was also my understanding from the presentation, excuse me, at our last meeting that you were trying to get people stabilized and then maybe even refer them to another organization that could continue their care. And not necessarily, hopefully, like you said, you will get them stabilized and de-escalate it so they don't have to go to the hospital, but that you would also possibly be referring them out to other organizations or other facilities that might be able to provide further care. Is that correct?
That is correct.
Okay. Okay. So thank you. Thank you for those answers. And then Member Tornatori.
Thank you, Chair. I appreciate questions from everyone and members A being the dean of the county board, someone who I've learned a lot from. A couple of things. There have been a number of entities that have been involved in this for a long time that many of us don't know about. We've had stakeholder meetings and DuPage mayors and managers have been a participant. There have been village managers assigned by DuPage mayors and managers to be at those as kind of the liaison. We've had the sheriff, we've had all the hospitals. CDH is off the wall about this. They love the idea. So yeah, of course, taxes are part of the operational cost, but I didn't see anywhere in that presentation about tax increases. That's my concern. All right. Let's understand that everybody's going to have to buy into this. Am I too close to this? I don't think so. Am I close to it? Absolutely. And we should all be close to this because it affects everybody. Adam, maybe I'm wrong, but didn't we have something where we have twice as many youth, twice as many people in DuPage County who undergo crisis than other counties in the state?
Yeah, I think it was a presentation from our prevention leadership team that focuses on youth that showed we have significantly higher rates of substance use and depression.
Right. So, I mean, our county's great. We have a lot to be proud of, but we got a lot of issues that we have to deal with there. And this is going to be one of these that we have to go with it. So I'm all for questions. I think we have the answers. We don't have all the answers because it's still going to take time. By the time this gets built, a lot of these questions are going to work themselves out naturally, organically. And I think if we all work together, it's going to be something we can all be proud of. So thank you all.
Thank you. Thank you, Member Tornatori. And thanks everyone for the respectful and good conversation that we had, good questions, got a lot of great answers. So this is how it's done. We ask questions. Everybody should be able to ask questions and that's what I try to encourage. So, all right. Any other discussion on this matter? Okay, so we're voting on the original motion as amended. All those in favor? Opposed? Motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0158-23, our 2024 holiday schedule.
Motion by Member Krajewski, second by Member Galassi. Any discussion? All those in favor?
Aye.
Opposed? Motion carries. Member Krajewski, we move on to information. I'll call on Member Krajewski.
Thank you, Madam Chair. I move on receive and place on file informational items. A, payment of claim. B, wire transfers. C, appointments. And D, grant proposal notifications.
Okay, I have a motion by member Krajewski to receive and place on file items A, B, C, and D, and a second by member Guston. Any discussion? All in favor? Opposed? The motion carries. Do we have any old business? Member Krajewski?
Just one thing, I just noticed in the packets that we had, some of the agenda items were not labeled correctly under like finance resolutions. They were 9, like 8C was 9 something. Some of the 8s were 8, some of them were 9s. Just let you guys know that.
Thank you. We'll make a note of that. And member Cahill and member Guston?
Yes, thank you, Madam Chair. Thank you for the update also on the clerk's office. But I do want to follow up and ask, has the clerk agreed to comply, as all other departments have, with the Illinois Attorney General's office's opinion and our state's attorney's opinion regarding budget transfers?
I am not sure. Nick's coming up to. Thank you, Nick.
So the question is, have they agreed to comply? I can tell you that they have agreed to do all the necessary budget transfers and the paperwork needed to get the vendors paid, to do the transfers, to pay the invoices outstanding out there. Whether it's a long term or not, I don't know, but I know that we have solved all of the backlog as of today.
Follow up, I know that. But the question is, are they going to comply going forward in September when they're going to be short?
That's a question you'll have to ask the clerk.
So we're still unresolved with this matter, because every other department right now has filled out the necessary paperwork in order to comply with these opinions. And what you're telling me is in the short term, they're paying for all the bills coming up, but they're not complying with what's gonna happen.
So, I mean, it's a tough question because they're in compliance right now. So you're asking me something, will they become out of compliance? I don't know. I mean, in September, is there a budget transfer needed for salaries? Yes. Do they have to do that now? Not necessarily. So they are not out of compliance right now. Will they stay in compliance? Will they be out of compliance? I don't know until we get to that point in September.
I thought there was some specific paperwork that had to be filled out, not just for the short term, but for the long term also, as all other departments have done so.
The only thing that we had a discussion on was budget transfers when they have a certain line that is under or out of money, and they have solved everything that is under or out of money right now. Whether, we did talk before about the salary issue that we anticipate by the end of the year will be a negative balance, but they are not out of compliance right now. So as of today, when that budget transfer is approved at county board, they will be in compliance. Whether they fall back out of compliance, I don't know.
Thank you, Nick. Thank you, member Cahill, for the question. Excuse me, member Guston.
Thank you. Yes, I just wanted to let everyone know, we just talked quite a bit about mental health and addiction and all of the money that we need to spend to be reactive to situations in our communities. And there are communities now that are actually passing laws to make it unlawful for THC sales to our minors, which they can buy now at gas stations and businesses as the law now sits. So we know it's detrimental to our youth and their mental health to be able to have this available to them in a lawful way. So I asked staff to look at, maybe there's an ordinance we can do that would not allow, it would be unlawful for minors to purchase THC products from gas stations and other businesses. We are not home rule, unfortunately, so we don't have that flexibility. However, maybe the legislative committee or other committees might be able to look at this. So just out there, so you know that that's kind of working in the background if we can do anything to help our youth.
Thank you for the comments. And Assistant State's Attorney just informed me that, yeah, we are not home rule, but, maybe we could work through it through legislative and, that would have to be done that way. But thank you for bringing that up. It's a good point. Okay. Any other old business? Oh, Nick, come on up. Yeah.
To your question, I want to do a clarification. So we just went through, all of the line items have been resolved regarding invoices. There is still a negative balance on temporary salaries that we're working through. We haven't really focused on that because it doesn't have any impact. And so I just wanted to be clear in what I was saying before, the negative. So there is a negative remaining in temporary salaries that we haven't really paid that much attention to. We've been focusing on the invoice. So I just wanted to be clear with the board.
Thank you, Nick. Any other questions or comments? Okay, seeing none, can I have a motion to adjourn? Motion by member Tornatori, second by member you. All in favor? Okay, see you all next meeting.